Hey, so I'm gonna teach you the best way to use Anbesol if you're having a toothache because the instructions on the box aren't really that helpful at all. But the all you really need is just like piece of paper towel, some gauze or something to wipe with, and then also a Q-tip. So the first thing you want to do is you actually want to dry the entire area of saliva so that there's no saliva on the area that you want to put the Anbesol on. Okay, and then the next thing you want to do is you just want to use a Q-tip, squirt some on there, and then use this to kind of rub it all over the tooth and on the gums of the tooth that is bothering you. Okay, I mean, a lot of times you can't tell if it's coming from the tooth or coming from the gum, so why guess when you could just put it on both of them, right? So, and then after that, the next step is the most important one, is you actually want to tilt your head to the opposite side. So if this is the tooth that's hurting you after you put the Anbesol on, you just want to tilt your head to that side and just kind of stay like that for about like a minute or two. The reason for that is because when the saliva starts to pool, you want it to pool down here and not in the area where you kind of applied the Anbesol, right? Because if you just kind of stay upright like this and you start salivating, all of the saliva kind of wash away the Anbesol or dilute it, and then that decreases the efficacy of the pain relief from the Anbesol, right? So like I guess a similar analogy would be if you had like a cut or scrape on your arm and then you're trying to put it on while you're in the shower, right? That doesn't make a lot of sense, and neither does it inside your mouth either. Okay, so I mean basically the entire thing that you should focus on is to kind of keep the area dry, so that way the Anbesol has time to kind of work on the tooth or on the gums. Okay, and that's how you get the most pain relief from using this oral anesthetic. All right, so that is the best way to use Anbesol.